Hello, my name is Anssi Peräkylä and I'm the first author of the symbolic interaction paper with the title From Engagement to Disengagement in a Psychiatric Assessment Process. My co-authors are Liisa Voutilainen, Maarit Lehtinen and Mariel Vuolia. We all work at the University of Helsinki. In our article there actually are two stories in one. One is a story about a young woman seeking help in psychiatric clinic. The other story is a theoretical discussion on Erving Goffman's sociology. I will tell you about both of these stories. So, we have a story about a young woman, her pseudonym is Mia, who cannot control her aggression, tends to hit others, shout to her friends, drinks too much and cannot manage her vocational training. She gets in touch with a psychiatric outpatient clinic. The psychiatrist and the nurse interview her for 9 times. Their aim is to find out the diagnosis and the best way to help Mia. In the article we show how the interactions between Mia and the clinicians changed during this process of 9 interviews. It is not a story of successful treatment. In the beginning, Mia is very engaged in her discussions with the clinicians. She is attentive with her gaze and body. She answers clinicians' questions in a constructive way and she shows that she wants to get better. Here you can see a frame graph of a moment when Mia is telling the doctor what her own goals for this treatment are. Then, during the subsequent interviews, she gets more disengaged. She is less attentive through her gaze and body. She starts to answer the questions in a defiant way, and she displays that she does not really value the things, such as moderation and self-reflection, that the clinicians expect from her during the interviews. Here you can see 2 frame graphs from such moments. Mia shifts to and fro between engagement and disengagement. In the final interview, there is a conflict between Mia and the clinicians, and she disengages in a very angry way. You can see some moments here. The goal of the psychiatric assessment is the delivery of diagnosis and treatment recommendation. When the clinicians give the diagnosis and suggest treatment, Mia shows neither uptake nor interest. Here you can see how she is looking away from the clinician and fiddling with her fingers when the clinician has just given her the diagnosis of asocial personality disorder. The story about Mia helped us to formulate the other, more theoretical story that is written in the article. This story is a discussion about the concepts of engagement and disengagement in Erving Goffman's sociology. Goffman pointed out that engagement is a moral obligation in social interaction. Yet he also argued engagement is always haunted by the tendencies of disengagement, like not being fully there, not being attentive and present, but withdrawing from the encounter. By examining Mia's engagement and disengagement, we are able to elaborate and specify Goffman's ideas of engagement in interaction. We argue that engagement has 3 overlapping components: perceptual and bodily orientation, alignment in action, and sharing of the moral order. Our paper also shows how the detailed examination of language use and bodily expression can help in elaboration of such concepts. How exactly did it help? You will find it out by reading the paper.